Hello, and welcome Bill and Melinda Gates Foundation to an overview of maternal morbidity among races in the U.S. My name is Erica Penrod. I am in my senior year Master's in Public Health candidate at the University of New England. The focus for today is maternal health in pregnancy. From prenatal to postpartum, maternal and infant health determines generational trends. Contributing factors to this primarily include diet, exercise, lifestyle, and culture. Women who are pregnant or planning to be risk their health with each pregnancy. From pre to post-birth, maternal health should be monitored and supported for optimal postpartum health. This health issue directly affects the infant health and mortality rates as well. Now, this is occurring in the United States, but globally as well. In the U.S., the population that is impacted the most is the African American population. Due to urban, compact, low-income housing, its residents face daily racial inequities. Women should be taking pre-contraceptions and prenatal precautions to ensure their best efforts are being put towards staying healthy throughout their pregnancy. This reduces the risk of maternal health issues and birthing complications. Additionally, creating positive habits around folic acid intake will aid in reducing birth-related defects and deformities. Without this proper health care, maternal health becomes to be not only a financial burden, but a long-term generational health concern as well. For policy specialists such as myself at the legislative level, funds target subtopics such as infant mortality prevention, prenatal care, injury prevention, and emergency medical services. So getting into the contributions per socioeconomic level, at the individual level, it's really about engaging in the individual engaging themselves in learning and listening regarding sex education, as well as health and general health habits overall. A barrier with that is self-stigma and classification. Going into interpersonal, the biggest both resource and barrier is family and social support. There are proven statistics that midwife and social support aid in the success of maternal and child health, but transportation still poses the biggest barrier regarding these healthcare services. Additionally, when you get into the community and policy, you don't see as much of the day-to-day transportation, but it's more social media dissemination of information at the community level, not being true. So it can be a great resource for people in rural areas. But at the same time, check your sources. Not everything that you see on social media or even on the internet is always true. And then getting into the policy level, you've got resources such as World Health Organization guidelines, but another barrier there is that there's no lacking of national system reporting. So how do we address all of this? Well, we have to get into some interventions. To address maternal and child health, some overall great approaches are nutrition-based, mental health-based, and physical health-based. So the nutritional-based interventions primarily focus on dietary intake, supplement use, lifestyle practices, and clinicians can best promote long-term maternal health by creating some positive habits. For mental health interventions, we're looking more towards tailored towards racial minorities, really respecting their culture regarding mental health. And then getting into physical health, it's more along the lines of transportation as well as physically getting up and being active and getting engaged in your healthcare process. So as a policy specialist, I would use the time frame given as a model for prenatal, partum, and postpartum. That allows, at least one visit per month, beginning 3 months prenatal through 3 months postpartum. And then getting into the mental health activity, it would be more of a one-on-one interview and consultation, very private, more of an intimate setting, allowing for honesty and trust, which will be huge at minimizing response bias. So by helping to support this emotional well-being of these mothers, clinicians should be able to provide a more thorough assessment and individualized steps towards treatment. So overall, mental health is a huge factor to be addressed, but it is a sensitive factor at that. So direct participant feedback will determine the success of the interventions. So if the attendance is within 90%, nutritional intake will have a significant increase. We will see an overall considered complete success. And that's 90% feedback. That's getting the substantial feedback from participants. To obtain this, ongoing evaluations will supply and gather objective data, providing information for analysis and archiving. And you'll see some of those connections later on in the logic model about what that data can really do for us. So this overall success or response count, it helps to ensures researchers as well as legislative policy specialists like myself have a more accurate picture and description of the successes, failures, and socioeconomic factors that contribute to poor maternal health during pregnancy. Researchers will collect feedback surveys pre, during, and post-intervention, and that will allow more response overall just via the span and the duration of the surveys. Additionally, data will be collected via online and paper copy, just making sure that we reach our entire participant audience as much as we can. Participant feedback will be the primary evaluation approach for the intervention. Success is dependent on the participants in experiencing improved mental health postpartum compared to their expected or typical behavior patterns. Additionally, activity counseling, so measuring the impact of nutritional health both during and post-pregnancy through a counseling session with a nutritionist, will aim to promote maternal health as well as long-term positive family habits that she will hopefully pass on to her kids. So to obtain an accurate description of mental health, physical health, and nutritional intake, follow-up and feedback surveys are going to be administered long-term, as well as checkups just to see where the participants are at and if they've upheld any of their habits or what they've experienced overall for long-term health issues. So getting into the barriers and possible solutions for these barriers, this is seen across the board when you're trying to engage the community, whether it be rural or urban. The factors do vary, but these are fairly typical barriers seen. So socioeconomic factors such as transportation is a huge barrier, as well as time. So when you're trying to access quality information, a barrier there would be social media, like we talked about with the dissemination of information and how that's not always accurate. A solution, providing resources and giving them resources to share with family, share with friends or coworkers. An additional barrier, like I said, was engagement, and that would be time and transportation. Us having manpower for the interventions in the study will help to kind of alleviate this barrier. Another solution, making it convenient. Making it convenient, we need the manpower, as well as maybe providing some healthy snacks to promote healthy habits. Another barrier is seen as the access with the transportation and insurance. Making this convenient as possible for our participants is going to be how we're going to get the most feedback to really see the best results. And you've heard me say before, if you have manpower, access, and transportation, then you will have approved access and coverage to healthcare and information for analysis and archiving, as well as actual utilization of the care services, promoting long-term health, maternal health, and infant health. So thank you to the Foundation and all of you listening this evening. Have a great night.